Hello, and thank you for choosing Henry Meds as your healthcare partner. In this video, we will be demonstrating how to perform an injection as part of your program. Before beginning, make sure you have the following supplies: a sterile syringe and needle, your prescription medication, and disinfectant wipes. Start by washing your hands thoroughly with soap and water. This will help to prevent bacteria from getting into the vial and contaminating the medicine. Once your hands are clean, open the alcohol swab and clean the top of the vial. Next, hold the vial upside down in one hand and use your other hand to insert the needle into the vial. Make sure the needle is all the way in and that there are no air bubbles in the syringe. Now slowly pull the plunger of the syringe back to the correct dose of medicine. Make sure you are drawing up the correct amount of medicine. And don't touch the tip of the needle or let it come into contact with anything. Once you have the correct dose of medicine in the syringe, carefully remove the needle from the vial. Again, make sure not to touch the tip of the needle or let it come into contact with anything. Now let's administer the injection. I'll be demonstrating it on this orange, but you can perform your own injection easily. Use the alcohol swab to clean the area of skin where you will be injecting the medication. Allow the skin to air dry for 60 seconds. Do not touch the cleaned area again with your hands. Next, hold the syringe like a pencil with your thumb on the plunger. Gently tap the syringe with your fingers to remove any air bubbles. Then pinch a fold of skin between your thumb and forefinger and hold the syringe at a 45-degree angle to the skin. Carefully insert the needle into the skin and then push the plunger slowly to inject the medication. After the medication has been injected, carefully remove the needle from the skin. With a sterile bandage, apply gentle pressure to the injection site. You don't need to rub the injection site. Dispose of the syringe and needle properly, such as in a puncture-proof container, and that's it. By following these steps, you can safely perform injections as part of your Henry Meds program. As always, if you have any questions or concerns, be sure to consult with your healthcare provider.